Good evening. Welcome to Spine Time. Dr. Chi, please begin your presentation.
Hi, everyone. My name is Michelle Chi. I'm a rehab physician at Weill Cornell Medicine. For those who are joining us for this first time, this is our Spine Time webinar. And today we're going to be talking about how our smartphone is affecting our neck or causing a pain in the neck, similar to what we now call tech neck. We have two expert physicians that are going to be talking to us a little bit about different causes of this pain and some anatomy, as well as different ways to treat and prevent some of these symptoms. So for those who are not familiar, we're all part of the Center for Comprehensive Spine Care at Cornell. So we're truly a integrative department, and we utilize a multidisciplinary approach, which involves collaborating with several different departments, and that includes pain management, anesthesia, rehabilitation medicine. We also collaborate with neurologists as well as spine surgeons. We also provide services including complementary and alternative medicine too. So we truly are a collaborative team, which is really helpful for impacting spine care for our patients. So today we have two speakers with us. We have Dr. Dan Peck, who is board certified in anesthesiology and pain medicine. His clinical focus is on treating complex back and neck pain using minimally invasive treatments and utilizing injections, neuromodulation. He currently sees patients at the Spine Center on the Upper East Side at Cornell, as well as at Lower Manhattan Hospital. And then we also have Dr. Jatin Joshi, and he's also a board certified anesthesiologist and a pain medicine physician, also treats a similar array of pathologies. He also sees patients at the Cornell Spine Center as well as on the Upper West Side. So I'll first have Dr. Joshi take it away for us.
Sure. Thank you, Michelle, for the introduction, and thank you everyone who's able to join us. We all have heard about how smartphones and technology in general are a public health epidemic in terms of, mental health, but also they play a very significant role in our posture and subsequently our pain. And so today we're going to talk to you a little bit about some of the complex issues related to pain in the neck, related to prolonged iPhone or mobile phone usage. And then we'll talk about some of the potential treatments, and then we'll be happy to answer any questions that you have as well. So in this first slide, what I'm going to do is just talk about the basic functions of the cervical spine. We all know that the spinal column in general is a very complex structure, and it has a variety of critical anatomy related to it. So that includes a variety of nerves, bones, joints, tendons, ligaments, and muscles. And all of these have a complex interplay and help us to not only keep ourselves upright, but move, and then also use our arms and legs. So the cervical spine is protected by the spinal cord. It ends at the base of the skull, or starts at the base of the skull, and extends down to 7 cervical vertebral levels. The purpose of it is multifactorial. The cervical spine supports the head and its movements. It helps house some of the critical blood vessels that we need to supply blood flow to the brain. And it contains 8 pairs of spinal nerves, which innervate or send signals back and forth from the brain to the neck, the shoulder, the arms, and the hands. We can go to the next slide. So here I'm going to talk about some of the basic structures that are involved in keeping us upright and help us move, and then also how they can contribute to pain. So your neck muscles are part of a complex musculoskeletal system. And when I talk about musculoskeletal system, I mean just the soft tissues and the bones that are around our neck. And they're important in connecting the base of your skull to your torso. And so you have more than 20 neck muscles. The muscles that we have in the neck, they contain fibers that contract or get smaller and squeeze. And that allows us to perform lots of different movements. Your neck muscles help you do everything from chewing and swallowing, nodding your head, rotating your head. So they're very critical. The muscles in our neck are called skeletal muscles, means that they're attached to the bones by tendons, and they're voluntary muscles. So you control how they move and they work. Other types of muscles in our body are cardiac muscles in the heart, or smooth muscles, which are in hollow organs like your stomach. And they're involuntary, which means that they work without you having to think about it. In regards to the bones, you have 7 cervical vertebrae, and they form the bony structure of your neck. They're hollow in the middle, so they allow for space for your spinal cord. And there's specific openings in the side of the vertebrae that allows for nerves to traverse in and out of the spine and extend to your neck and your arms. People often refer to the spinal cord and vertebral column together as the spine in just anecdotal speech, but really they're 2 separate structures. Your spinal cord is really the band of tissue, the nerves and the cells, and the vertebral column are the bones. And that is the protective layer that really serves to bring structural support to the spine and also keep our spinal cord protected. So lastly is the nerves and the tissue in the vertebral column. So we have the spinal cord, which runs through the center of your spine, and it runs from your brainstem all the way down to your lower back. It's a very delicate structure, as we all know, and it contains all the nerve bundles and cells that carry messages from your brain to the rest of your body. In between each vertebrae, in the front part of the vertebrae, which is called the vertebral body. Sorry, I don't have a way to point, but there's a disc, and that's kind of like the cushioning in between the bone. So I like to think of it as your spine is being like a building, and in between the bones are the bricks, and then in between each bone there's mortar, so that's like the disc. And all of those structures serve to help us move and help support our upright posture. So we can go to the next slide. So what happens initially, so this is actually an imaging of your cervical spine, and I'll go through that in a second. But what happens initially is that the muscles have to strain to hold our head up. But as the muscles tightened, they put more pressure on the bones and the discs. And that makes discs wear out faster. And as the discs wear out faster, they can herniate or bulge out or even rupture, and that impinge the nerves in your spine. And that can cause pain in the neck, pain in the arm, numbness, or pins and needle sensation. And that's what people typically come to see us for. So this picture here is depicting the bony structure of the spine. One of the interesting things that we do here is there's a variety of ways that we are able to assess the spine, in addition to interviewing patients, getting a history, and then doing a physical exam. We're able to get different types of x-rays, CT scans, and MRIs. And there's a previous spine time that really goes through a lot of the imaging that we do. And I'm sure it's available on YouTube. So this is a scan to help us look at the bony structure. So if you look at the left picture, that's what's called an axial view. And that allows us to look at the vertebrae at each level. So the first picture on the top of the first picture, that large circular structure is called the vertebral body. And if you think about the vertebrae like a ring, this vertebral body is like the diamond in the ring. And then the rest of it is the back portion. And so the part we're most interested is in what's called the facet joint. And if you could point that out on the axial view, Michelle. Or yes, so that's the facet joint. That's where the vertebrae connect together. And that's a joint just like we have in the rest of our body, like our knuckles or our knee. And that joint can be susceptible to injury and inflammation. And what happens is that that black circular structure in front of that joint is what's called the foramen. And that's where the nerves in our spine extend out from the spinal cord and go into our arms and in our neck. And what can happen is that joint, as it becomes inflamed or arthritic, it will start to overgrow and cause a narrowing in that opening, which is called the foramen. And you can see that number 3, there's a narrowing in that foramen, and it can cause compression of the nerves in our neck. We can go to the next slide.
Good question. Are there certain symptoms that are pretty typical with what might be facet joint pain versus
Yeah.
pain coming from the degenerative disc?
Yeah, a good question. So the next slide, we'll talk about the disc, but one of the things that we really have to elucidate when we see patients with neck pain is the pain coming, obviously the pain is coming from the spine, but is it coming from the bony structure of the spine, or is it coming from the nervous tissue structure of the spine? And typically when we see patients who have pain related to a joint, in this case it's called a facet joint, we're typically experiencing what's called axial pain, meaning pain that does not radiate into the arms, does not cause numbness and tingling. So typically it will cause achy pain, especially when you look up or rotate your neck from the left to the right. The caveat to that is so that pain can be associated from the joint, but the joint can also cause a secondary pain, which is called radiculopathy. And that's when the overgrowth of bone will cause a compression of the nerve right in front of it in that opening that we see here, like number 3. And that nerve compression can cause pain down the arm. And so that is a secondary pain that is associated with the arthritis, but not directly arthritic pain. If we go to the next slide, we'll talk a little bit about the soft tissue structure. So I talked to you about radiculopathy, which is when pain is radiating down the arm. And part of the reason why we have that is what's called stenosis. Stenosis is just narrowing within the spine canal. And we often hear about radiculopathy from patients when they refer to sciatica. So that's when the patients have back pain going down the leg. You can get an equivalent symptom in the neck. What happens is either the spinal cord itself or the nerves that exit out of the spine get compressed. And that can be mainly from 2 reasons in the neck. One is arthritic overgrowth of bone causing nerve compression, which we talked about. And the second is disc rupture. Or disc bulging. The disc is a dynamic structure that is in between each bone and is susceptible to injury, especially from repetitive strain that we experience from using an iPhone. So prolonged flexion of the cervical spine. And I think Dr. Chi will talk a little bit later about the postures in the cervical spine and how that places an undue weight on pressure on the disc and the bone. And so that pressure will cause this disc to either bulge or squish out, or even in some cases herniate, which means that if you think about it like a jelly donut, the jelly is kind of coming out of the donut and it's pressing on the spinal cord or the nerve, and that will cause radiculopathy. So these are some of the symptoms that we see from prolonged overuse of mobile devices because of the strain of constant cervical flexion, meaning bending of your neck and staying in that static posture for long periods of time.
Right. So thank you, Dr. Joshi, for going over a lot of, what can happen when you have poor posture and you use your smartphone device for extended periods of time. And now I'm here to talk about, well, what can we do about it? Now, what we offer our patients certainly is offering the most conservative management possible. And that really puts an emphasis on maintaining, also improving function and pain. So these are the things that are listed that we oftentimes will offer as kind of the first line treatment. Now, that includes things like physical therapy and as well as home exercise programs. And there's an emphasis really on not only range of motion, but also core strengthening, which you may have heard us oftentimes emphasize during our clinic visits with our patients. But certainly that is what helps patients most long term. And then we can certainly talk about things like medications, injections, and other types of therapies. So next slide, please. So in addition to traditional physical therapy, which we will always encourage patients to do, and that is at an outpatient facility that most people will go to a couple times a week for 30 to 45-minute sessions, what we find is really most beneficial for patients is doing these regularly, even when you're not doing physical therapy at the facility. These are pretty easy exercises that you can do at home. And what it does is it really not only improves, again, range of motion, but also working on a lot of these core muscles that are really key stabilizers for the neck. When you're looking down at your smartphone, in isolation is usually not a problem, but again, many hours a day, 7 days a week, that's when people develop problems. And so when you're putting that much strain on, you do have to strengthen a lot of these muscles. And that's why core strengthening is something you'll hear us talk about all the time. Most of the time in kind of reference to the lumbar spine and the lower back, but now also the neck areas. And so these are some pretty easy exercises that you can do at home. But certainly we do encourage patients also to work alongside with their physical therapists. And oftentimes these physical therapists can also provide a good home exercise program that's pretty regimented, so you can stick to it and do them very regularly. Next slide. So other types of medications, and these are medications that you may or may not be pretty familiar with. First-line medications include different types of anti-inflammatory medications. This is kind of in the family of Motrin, ibuprofen, naproxen, a lot of the over-the-counter stuff, although some medications can be offered by your spine specialist that are prescription-based. Different types of quote-unquote nerve pain medications may also be offered if you have a component of pain that radiates down the arm, as Dr. Joshi talked about with any kind of nerve impingement. So these are medications like gabapentin. Also, we use a variety of different types of antidepressant medications that are used off-label for different types of nerve pain. Common one would be a medication like Cymbalta or duloxetine. Now, if there is a big muscle component to it, especially muscle strain, then muscle relaxants may be offered. And there, I didn't list them all here, but there's a slew of them that all essentially try to achieve the same thing by different mechanisms. And so your specialist may recommend that as a potential medication. And also there are a variety of different types of topical medications. So topical anti-inflammatory medications, topical lidocaine, among other things that can be recommended as different types of alternatives in addition to your physical therapy. Next slide, please. Now, when you've exhausted, or let's say you've done the physical therapy and the home exercise program, or let's say for some people who are looking to be, let's say a little bit more proactive in terms of their treatment and want to also look into interventions, then certainly we're happy to offer that. And all of our specialists do that at the Spine Center. Now, one of which is trigger point injections. And these are injections that are actually done into the muscle belly. We will oftentimes offer this also as a first-line therapy as a way of treating different types of muscle-related pain. And what this is essentially doing is sometimes we'll inject local anesthetic, sometimes it won't be anything at all. But the key here is doing needling on the muscle to be able to offer relief of that muscle pain.
Are there any side effects with these types of injections that we should be aware, or patients should be aware of?
Yeah. I mean, in terms of this procedure specifically, it's a pretty low risk procedure, but certainly one thing I will always warn patients of is sometimes you can have some soreness after the procedure. And that's just from the fact that there was a needle there and there is dry needling involved. I think the risks of the procedure itself, like bleeding, infection, et cetera, those are all pretty low. And so probably the most common one would be some soreness afterwards, which most people can treat with ice, heat, even some, again, anti-inflammatory medications that only usually last for a couple hours to several days. Now, when there's a component of what we call cervical radiculopathy, or let's say nerve root impingement, as Dr. Joshi pointed out, and so this is, most people, when they associate nerve root impingement, they're talking about sciatica. Well, you can develop a very similar type of thing in the neck, and that's usually characterized as kind of a shooting pain down one or both upper extremities. It can also come with some numbness, and people say like a tingling sensation also. When it's particularly severe, some people even have weakness. So they'll say that they have dexterity issues, trouble opening jars. So those are common questions that you may hear us ask you. Now, when you have a component of that, then a cervical epidural steroid injection may also be offered. And what that essentially involves is, in those areas where there is that nerve impingement, we can inject a little bit of an anti-inflammatory medication like a steroid to be able to not only decrease the sensitivity of that kind of really angry nerve, but also in areas where there's inflammation to be able to provide an anti-inflammatory medication. We tell most patients that this can take some time to work. So anti-inflammatories can take up to 10 to 14 days to provide relief. So to be patient with that, but can be a very effective treatment in patients with this kind of cervical radiculopathy. Next slide, Dr. Chi. Now, for patients with what we call axial neck pain, so neck pain that doesn't have a big component of this shooting pain down the arm, but it's from the joints of the cervical spine, which is a very common problem that we see. So when people talk about arthritis of the cervical spine, this is oftentimes what we're talking about. Then we may offer something like a cervical medial branch block. Now, what this image is showing here is that when there's bony overgrowth, when there's kind of erosion of the joints themselves, that can be pretty darn painful. And oftentimes there isn't necessarily a surgery that may be offered for something like this. So for those patients, we start by doing something called this medial branch block. There are nerves that carry the pain signals from those areas. And so the first step is doing a diagnostic test block, which is to be able to identify, first of all, is this the source of your pain, and also is this the appropriate level that is causing your neck symptoms? Next slide, please. Now, provided that those blocks do give you relief, and I'll always counsel patients that the diagnostic test block is not intended to necessarily give you long-term benefit. So even if you get several hours or the rest of the evening and you say, well, look, this really helped me with my pain, then we may do something called a cervical medial branch radiofrequency ablation, which instead of just injecting numbing medication in those areas, we actually apply heat in those areas. And what that does is that de-innervates, or essentially renders those nerves functionless. I think when people hear about this, they can be pretty intimidated because it sounds like, well, you're doing something with nerves and you're burning nerves. I think that's sounds more aggressive than what's actually involved, because these nerves, fortunately, only carry pain signals. So they don't do function in terms of carrying sensory function from different areas. It doesn't do anything with motor function. They just carry pain signals. And so that's what enables us to do this safely and to be able to provide patients with relief. And we tell most patients, 12 to 18 months is oftentimes what we hope for in terms of how effective this therapy is. Many people will ask afterwards, well, what happens when the pain comes back? And if the pain does come back and it's severe, then we can repeat this procedure, but we don't necessarily do these things with the intent of doing them serially. Next slide, please.
All right. Well, thank you, Dr. Joshi and Dr. Pak. It was really helpful just learning about the different anatomy, kind of symptoms to look out for, the different possible diagnostic criteria, and different symptoms that we should be looking out for when we're on our computers, looking at our phone. So this is actually, there's an initiative from the National Spine Health Foundation that I wanted to show everyone joining us today. They launched a public health educational campaign called Look Up, which is a free campaign. And this initiative has been launched in conjunction with the Cervical Spine Research Society, basically aiming to educate everyone about prevention and treatment of tech neck from prolonged use of our handheld iPhone and desktop devices. The link is right here on the screen, so you can take a picture of it, and go on the website to look at some helpful tips. So, this is really helpful for really preventing neck issues, including not just muscle pain, but disc pain, joint arthritis, disc herniation, disc bulges. When you're looking at your phone, especially in this lower hand corner, you can really see the difference in how much extra pounds of weight are added to your spine, which correlates to how much disc pressure is on your spine, which then can lead to more disc pathologies, disc bulges, and disc degeneration. So, one helpful tip, as you can see, based on this diagram, is really working towards elevating, raising your neck and having a neutral spine posture, which is what we usually try to educate our patients. A lot of us, especially during the pandemic, are working from home now with relatively poor home workstations, where we're probably doing work on our couch, curled up with our laptop, looking down at the screen, without an actual chair. And so, some of the important things to consider when we're doing a lot of work from home is trying to optimize our home workstation. So that means making adjustments to your work setup. I usually try to educate patients to try to elevate their screen when they're using the computer. And roughly, I say to make sure your eye level is around the upper 1/3 of the screen. So it basically sort of forces you to look up, and that helps create a more neutral, open posture. Other things, we sort of discussed with the exercises in prior slides, really setting reminders to get up and stretch and do some of these upper back stretches. There's a syndrome of that forward flex posture called upper cross, where you have really tight pectoralis muscles, tight upper trapezius muscles, and that really pulls everything forward. And we really want to try to avoid that. So doing some of those stretches and exercises that Dr. Pack mentioned in those prior slides are going to be really helpful to prevent that kind of muscular strain and potential discogenic pain and disc degeneration in the future. And so those are just some really helpful tools, really reminding yourself to move, adjusting your home workstation, and then also looking at some symptoms that may be more worrisome. Dr. Pack and Dr. Joshi, are there certain symptoms that we should look out for that would warrant seeing a doctor or seeing someone at the spine center?
Well, certainly if you're uncomfortable and it's making an impact on your life and your ability to work and engage with your friends and family, and it's a chronic problem, then I think it's certainly worthwhile to just come in and talk and see what options you have. It doesn't necessarily mean that you need to get imaging or get a procedure, but at least have someone look at you and make sure that you're doing the right things preventatively. However, worrisome signs would be if you're having numbness in your arm, and especially if you're having weakness in your arm, or if you're having pain that is just out of control that's not able to be treated with over-the-counter medications. Other things to really look out for is if you're having gait and balance issues. So the spinal cord obviously plays a very important role in how we move our neck and feel our arms and move our arms, but it also has very critical pathways that help us with our gait, our balance. And if you're having problems with that, I think it's certainly wise to get evaluated, because those things should be treated more immediately than not.
Great. I don't know if we have any questions, but we do have a few minutes for questions if anyone has questions in our audience. As far as using ice or heat, when we're having some neck pain or neck soreness, do you find one is more effective than the other? What do you typically tell patients when they ask these things?
No, I think generally, Yeah, I don't have a single rule about that. I think whatever makes the patient feel better. I mean, I have some patients who swear by cold packs, some people they swear by heat packs. The one thing I will say about heat packs is try not to fall asleep with the heat pack on. I've seen patients certainly do that. And it tends to leave kind of, it's not necessarily burn marks, but certainly like markings around the skin if you fall asleep with like an electric blanket. So that's something that I would watch out for. Generally speaking, like cold is better as kind of an anti-inflammatory or as for something to combat a lot of inflammation issues, and heat is better for like muscle pliability. But I think people will generally figure out what makes them feel better, and I'm okay with either one. I don't know if you have anything else to say about that, Dr. Joshi and Dr. G.
Yeah.
No, agreed. Yeah.
All right, I don't think we have any additional questions. But if you do have any questions or want to make an appointment at our spine center, this is our number to call, or can also visit our website at comprehensivespine.weillcornell.org. Hope to see you all at our next spine time webinar. Have a great evening, everyone. Bye-bye.
Thank you.